Welcome to Chapter 11, Evaluation and Management. I think I've said before, this is my favorite chapter. Well, let's not say favorite, we'll just say one of my favorites. So evaluation and management has lots of different parts, and it's a very long chapter. So I want you to get prepared that we're going to be doing a lot of reading spread out over lots of days, 4 or 5 days. And I'm going to be doing live Zooms and Zoom classes to kind of help you get comfortable with E&M coding. I feel like you're not going to have any trouble, but remember, I'm going to be giving you helpful tips along the way. And if you will take my advice, E&M coding will be very simple for you. But what we're going to be talking about today is just this reading that you have coming up, some levels of E&M, and I have a slideshow. Would I be Miss Marcia if I didn't have a little slideshow for you? So we're going to go ahead and share a screen, and I'm going to just talk to you a little bit about what you're going to be learning about today. I do want to add a note. Everything that we're going to be talking about is found in the guidelines, which are the pages right before your evaluation and management section of your CPT. All right, so here we go. Oh, sorry guys, that was not a little bit of a clicking error. So again, chapter 11, evaluation and management. Remember, if you're going to be reading this in your ebook, it's going to be found under unit 3, chapter 11. Okay, there are 3 factors of E&M code assignment. We're going to have place of service, that's where you're having the service done. Sometimes it's noted as POS, type of service, which is TOS, and patient status. Now let's talk about each one of those areas. So what are places of service? Well, here's some examples. The doctor's office, the hospital can be inpatient, outpatient, observation patient. We have nursing homes, and we have the emergency room department. These are just a few of places of service that can be found in our E&M section of our CPT. Then we have types of service. We have consultations, admissions, newborn care, and office visits. Again, these are just some examples of types of service. Then we have patient status. New patient, established patient, outpatient, inpatient. It is vital for you to know the meanings of each of these statuses. It is in your reading material. I would make flashcards, I would make notes. I cannot stress enough how important it is for you to know what these 3 statuses mean. Now, I'm not going to go into the meanings of them with you at this point. I want to give you an opportunity to read and take notes on that, but we will be talking about these statuses. So we're going to talk about medical documentation and why it is so important. So I had just a little bitty video here.
Hi, I'm Angela at the Centers for Medicare and Medicaid Services. As a healthcare professional, your goal is to provide the best patient care possible. You document on a daily basis, but do you think about how your documentation fits into patient care and claims payment? Proper documentation of items or services is the primary communication tool for promoting quality patient care. Documentation is the vehicle that communicates who, what, when, why, and how to other patient caregivers. Proper documentation is important for a number of reasons. First, it ensures that patients get items or services that are reasonable and necessary. Next, proper documentation supports proper claim payment. When you completely and accurately document the items you furnished or the services that you provided, Medicare can process your claims for those items or services correctly the first time. Proper documentation also helps support favorable medical review decisions, and in turn, it reduces the administrative costs that are associated with appeals. Even though we know that proper documentation is important, the Comprehensive Error Rate Testing, or CERT program, continually finds that the leading cause of claims errors is insufficient documentation. So what is insufficient documentation? To understand what insufficient documentation is, let's start with what it isn't. Insufficient documentation doesn't mean documentation doesn't exist. It means that something was incomplete or missing from the documentation submitted with the claim. Now that we've discussed the benefits of proper documentation and we understand what insufficient documentation is, let's take a look at what happens when you don't provide proper documentation. When your claims are denied, your practice or facility loses revenue. Take a moment to consider the cost to your practice or facility because of claim denials. Appealing claim denials can be costly. The time and costs associated with resubmitting a claim, from completing forms, submitting documentation, and sometimes sending a letter about why you believe the claim should be paid, all cost time and money. Proper documentation is a sound way to protect the financial health and sustainability of your facility or practice and your medical peers. Ensuring that your documentation reflects the medical necessity of the items you furnish or the services you provide, and correctly coding your claims will help reduce denials and reduce overpayments. Even more importantly, proper documentation is critical to proper and comprehensive patient care. Think of it this way. If an order is illegible, a patient could get the wrong medication, test, item, or service. Patient care errors and financial consequences can significantly impact your facility or practice. And that's why it's important to respond to documentation requests from the CERT program, clinics, facilities, laboratories, durable medical equipment suppliers, and other physicians. Your documentation may support a related claim review. Here are some tips to help you if you need to respond to a request for records from the CERT program. First, make sure you send all associated documentation supporting the item or service you billed. Keep in mind, some of that information may come from a prior encounter or a test performed earlier than the date of service for the claim under review. If you're not sure if you should include the document, it's a good idea to include it anyway. It might be the key document or information that supports the item you furnished or the service you provided. Next, make sure you send the documentation by the deadline in the request. And then the last step is to review your documentation. A good way to double check is to make sure that it answers the questions who, what, when, why, and how. Even the most comprehensive documentation must not only verify that each item or service billed was performed, but it also must verify the medical necessity for each and every item or service billed. Your Medicare Administrative Contractor, or your MAC, can help you understand the documentation requirements, such as the signature requirements. To get more information, you can visit your MAC's website. To review more information on Medicare's documentation requirements, you can review the Medicare Learning Network, or MLN, fact sheet that's called Complying with Medical Record Documentation Requirements. And for more information on Medicare's signature requirements, review the MLN fact sheet that's called Complying with Medicare Signature Requirements. Finally, the CERT AB MAC Outreach and Education page on cms.gov has more information to help you.
Sorry about that. Okay, so words to live by. If you didn't document it, it didn't happen. So we learned a few things, but I'm hoping the biggest thing that stands out in your mind is documentation. Now, I know that some of us have had some questions and we did some coding together, a little bit of that. And I've said, I wouldn't feel comfortable coding this as a coder because there's not enough information. Well, we're not coders right now, right? We're practicing to be coders. But if you're responsible for coding, it all begins with proper documentation. Now, do you document? No, you don't document. The physician documents, the nurse's documents, the physician's assistant documents, the radiologist documents, the anesthesiologist documents. We're responsible for interpreting that documentation, right? So if you do not have the proper documentation, you can't code it. You have to request or query the physician. That's what they call it in our curriculum, is you query the physician, which means you just ask the physician for more documentation. They're not going to get mad. It's part of the requirement because, again, I want you to burn this in your memory. If it's not documented, it simply did not happen, and you cannot code it. You can't code it just because he tells you to. Okay? The second thing I want to talk about is when they spoke about medical necessity and documentation. Medical necessity is exactly what it sounds like. It's telling the third-party payer this was medically necessary to do. So, for example, you wouldn't be coding a heart cath and using a diagnosis that has nothing to do with the heart, right? Well, we're doing a heart cath because she has an infection in her knee or her big toe or whatever. That doesn't make any sense. I know that's silly, but you have to make sure that it makes sense. And if you're unsure, ask. You can research. There's so many tools on the internet to help you make sure you're meeting medical necessity. The third thing that I want to talk about is denied claims. What you want is something called a clean claim. And what a clean claim is, you've coded it, it got billed, it got paid, it's clean, it's finished. You don't want to have to touch a claim again once you've begun. Does it happen? It absolutely happens, but you don't want to out of 100 claims, you don't want 30 to come back. You want to make sure that you have all your documentation and all your information in front of you before you begin. Now, I'm going to tell you that may sound daunting. That may sound like, oh my goodness, is there a lot that? Absolutely not. Most of the time, you have everything you need. Sometimes you don't, and when you get to your facility and you're in your specialty, for me, cardiology, I had logins to all the hospitals, so I could actually print out medical records if I needed more information. I had the tools to do that. You will have the tools to do that. I hope that you enjoyed our first lecture on evaluation and management, and I look so forward to coding this with you guys. Have a great day, and let me know if you need anything. Bye-bye.